My name is Hala Borno. I'm an assistant professor of medicine at the University of California, San Francisco. I'm in the Division of Hematology Oncology, and I'm a medical oncologist practicing genitourinary medical oncology at the Helen Diller Family Comprehensive Cancer Center. In my medical perspective, I think that COVID-19 is radically changing the way that we deliver cancer care, both in the context of conventional care or standard of care, and also in the context of clinical trials. It is forcing medical oncologists and really the healthcare community to reassess the way that we interact with patients, the way that we deliver care, the way that we assess symptoms, and the ways in which we monitor toxicities associated with our therapies. I would say that COVID-19 has changed every aspect of clinical care for my patients. I have changed almost all my routine clinical visits in my medical oncology practice to remote medicine. And that's really because of this imperative for risk reduction. I want to reduce the need for my patients to leave their homes. I want to make sure that the patients are not leaving their homes unless it's vitally necessary for them to be physically assessed or for them to receive a drug that is life prolonging. Not only that, I have had to reassess the frequency in which I collect information about my patient's well-being. And by that, I mean the frequency in which I asked for blood draws, the frequency by which I asked for scans, and then also the frequency of certain therapies that I'm delivering. All of this has to do with this imperative of risk reduction. If I feel that I can safely delay certain components of a patient's treatment plan in order to reduce the risk of entering a global infectious environment, I absolutely am favoring doing that at this time, all again underpinned by this imperative of risk reduction. You're absolutely right that this is an incredibly stressful time for patients. As a medical oncologist, we are dealing with some of the most vulnerable patients in the healthcare system. And COVID-19 has increased worry, has increased anxiety. Some of this has a lot to do with the concerns for an increased risk and the risk of infection and the risks associated with infection for our patient population. Some of this is greater than that, is contextual. We know that COVID-19 has impacted the well-being, the financial circumstance for a lot of Americans, for a lot of people across the world. And there are aspects of that that are difficult to change. I think as a healthcare professional, we obviously need to acknowledge that these factors may affect our patients' quality of life. We absolutely need to acknowledge whether or not factors such as financial well-being, changes in financial circumstance may affect the ways in which they can receive cancer treatment. And I worry, would this affect adherence to cancer therapies, ability to present to the cancer center? I think these are some of the questions medical oncologists need to be asking at this time. And I think we should always acknowledge the fact that first and foremost, our patients are human. They're going to have these emotions at this very terrifying time. And we need to ensure that we create a space to listen to them as they convey, what emotions they're feeling during this time, and leverage any resources that we may have available to help them get through this. Today we're dealing with an incredible public health crisis uh, that absolutely requires cooperation with the larger communities, the medical community, patient advocacy groups, to ensure that we can uh, access as many resources, both physical resources for healthcare personnel, resources to ensure the safety of our patients, and also an investment in taking the long view, as this crisis will take time to heal as we move forward.